so that we have, as you all know, we do try to share the recordings within about 2 business days after they've sort of processed in the back end. And we do share them onto our website. This call also is being translated, so there is French translation available. Il y a de traduction en français disponible. So please make use of that, and please, to all of our speakers and those who engage in the question and discussions, please try to speak as clearly as possible, and don't speak as fast as I do, because that's generally unhelpful. So we will I think we'll just get underway, because we do have a lot that we want to try and get through. So Marshall, I'm going to stop sharing my screen so that hopefully you can get it up on your end. And just before everybody asks the question that we usually have for this, yes, these slides will be available to you after the call. We will make them available to those of you. There we go. But so please do know that you will get access to the slides later. You don't have to frantically try and screen capture them all. So Marshall, last summer we got the first set of data out of this research from you in a 20-minute presentation, slide presentation at the International AIDS Conference GFAN pre-meeting. So we've given you about the same amount of time today, and let's see if you can live up to the hype. So over to Marshall for his presentation, then we'll open up for questions and answers. Marshall, over to you.
All right. Thanks, everybody. Some of the information that I'm going to talk through, we shared the last time that we spoke, and so I'll go through it pretty quickly. There are a couple of things that I think are noteworthy that I'm going to spend a bit more time on. And I'm going to skip through the pieces that get into a bit of the redundancy, but more of the depth of the 2 additional findings that I think are noteworthy. And again, I shared the deck with Katie yesterday, and she can send it on to you. This information has now been integrated into the website, www.perceptionshub.com. So it's also available there. Just as a reminder, this project was designed to look at the most salient topics in donor, middle income, and lower income countries. What do people care about? What's the mood? How do they feel about the issues that we address? And also some specific testing around the Global Fund, in an earlier iteration, specific testing around Gavi messages. We went through 2 phases of research. The first at the top, wave 1, and then the second, wave 2. And those included these countries. The research was conducted in 2 ways, qualitative and quantitative, both through focus groups and surveys. The research was commissioned before the US retraction in funding and some of the other cuts that had happened. And we asked Brunswick to go back and do some desk research and analysis to make sure that whatever the findings were still held true, and to update any context. So again, this is a bit of the change context that we're all unfortunately too familiar with. The big headline is actually the perceptions on global health have changed relatively, not changed in any great degree. So the perceptions are pretty much the same despite the environment and circumstances. While there has been a big focus on ODA post USAID announcement, the prominence of global health in the media hasn't changed dramatically. ODA changed and certainly had a blip around the US retraction. So it does imply that there's a disconnect between media coverage of ODA and global health. The March data shows an increase in pessimism about global health progress versus the previous round of testing. It doesn't suggest a dramatic change, though. And this is you can see the future global health progress bars on the right. And then this is the desk research that was done. So third-party data showing concerns about healthcare has remained pretty steady. So that's post-USAID desk research. So the key findings in this round, the global mood is negative, something that we don't need to spend a lot of time on. But the recent experience and development in this testing is that there's greater positivity in emerging powers. And I'm going to spend a bit more time talking about emerging powers and the opportunity within featuring those countries and highlighting the work that has been done there and also the mood and optimism in those countries. Health remains still a more effective entry point for general development framing. And we need to balance communicating progress while also communicating urgency. The slight upside is that the USAID cuts and retraction have given a sense of urgency that otherwise we would have had to guard against based on progress made. We can be confident that our messaging remains effective. We need to remember, as always, this is specific to context and geography. And again, engaging Global South voices in donor markets tested even more strongly than the first round. And so we'll spend a bit of time on that. That's one of the findings. And then also how we frame people that are living in the Global South as active contributors versus passive recipients changes the perception of both community, the organizations doing the work, and those behind the work from a funding standpoint and a programmatic standpoint. And then the other distinction is that we should not think of the world simply as high, middle, and lower income or donor and recipient. Instead, it's useful to remember that there are shared perspectives across. And again, the emerging economies is going to be a theme throughout this. So the broader communications consideration in this new context. The first is that aid cuts in donor countries may lead to the assumption that global health institutions will be reducing their support. And in fact, they may. They also may not, but there might be value in separating GHIs from the general aid category and instead positioning them not as aid vehicles, but a separate category. The negativity and pessimism in the debate in high-income countries where support is diminishing heightens the value of these emerging powers that I keep mentioning that can bring more positive outlook to the future of multilateralism. They stand out as engines of optimism, and they have a really interesting perspective. So I won't spend a ton of time on the context. We really know what it is. The mood is negative. Again, the emerging powers are a much more positive sign. I'm not going to spend a lot of time on this. And this is what I was referring to. Emerging powers, Indonesia, India stand out as the most positive, possibly reflecting their recent experience of growth. South Africa is particularly negative in line with donor countries. And as in the first wave, the views are more positive about future progress, and we see the same patterns across markets. So not much has changed in that regard. Wave 2 aligns with many of the dynamics observed in wave 1, but again, these emergent powers. And so here's the summary. While patterns in aid support broadly with wave 1, emerging powers add a different perspective as both givers and receivers of aid. And I'll talk a bit about what I think this means for us. Donor country support in ODA is broadly in line with wave 1, but support is higher in those emerging powers. And a continued preference for countries to do their fair share on global health rather than lead trends, with the exception of India, which feels it should be more in a leadership position. Support for emerging powers to play a different role in development beyond traditional donors. And so when asked, you're more positive, you have greater optimism about aid and development, what should your role be? And so sharing knowledge, trading more with poorer countries, sharing experience with poorer countries, acting as a mediator, sharing knowledge again, trading, and then providing affordable medicines. So while emerging powers are more optimistic and see their role in a greater leadership position, financial support is at the bottom within South Africa, Indonesia, higher in India. These countries do not see themselves as donors who provide financial support. I just touched on that. Health is consistently rated as the top priority for support in both traditional donors and emerging powers. So I think that's good news for our work. What do we learn from the research from an aid dynamics? Net support for receiving aid, concern about exploitation colors discussion of aid in emerging powers and in lower income countries and middle income countries. And what does this mean for us? We need to disentangle aid from exploitation using language of partnership and collaboration and positioning global health institutions as partners in countries' development. So net support for receiving aid across emerging powers and Ghana. So you see the results here on this. We'll move on from this one. The majority in most markets feel that their country needs foreign help in tackling these challenges, the exception being India. And then this is a bit of the opposition, the exploitation that I mentioned. The way that we've used language, recipient countries, donors, et cetera. The relationship with the rest of the world should be of mutual benefit. And this gets at a bit of the mutual benefit argument that we have been discussing. They benefit from us. I think it's the other way around. Richer countries are taking a lot from us. Indonesia is like a version. In a den of thieves, we sit on a golden mountain. Our resources are abundant. And we see trends in development finance that will probably move more towards less towards aid, more toward resources. And this, I think, makes our case stronger that we need to decouple that from aid. From a recipient perspective, economic growth is still consistently rated as the most important area for support, which we'll track later on with that microeconomic message, which again tested most strongly. I won't spend a ton of time on this, the progress on global health. As in wave one, there's greater positivity about health in general, and it remains a more effective entry point when discussing our issues. And so this is views of past progress in global health over the past 20 years. And you see between those two waves. India and Indonesia are the exceptions to the pattern. Overall, emerging powers continue to be more positive than donors. And there's greater optimism about future progress in global health than progress overall, which again tracks with what we learned before. Greater support for funding international health organizations than ODA, again, decoupling global health institutions and the organizations they partner with from ODA in general is a more effective entry point into our advocacy. The health issues in developing countries, what did we learn? All health issues tested are perceived as important. There was little change in what the ranking within those. We need to balance communicating progress while communicating the importance of continuing to invest. And this is an area where USAID has, I think, supercharged the need for the opportunity to talk about the potential risks and jeopardy. And so all the issues, what is the most important to address? Child health, infectious disease right up there, access to vaccines as well. And then progress over the past 20 years in emerging powers. In those areas, child health and infectious disease, again, at the top of the list. And focus groups show that progress on health is cutting through, but also highlight that consequence of reduced urgency. The one from India is particularly interesting. HIV, malaria are diseases we should not be concerned about. India can manage these diseases and are already doing so. And so again, making the case is going to be important in those places, and also showcasing how emerging powers can be exemplar countries for what a path out of dependence on aid can look like. Making the case for health. What did we learn? Back to the messages. The economic self-sufficiency, health security, health equity tested the strongest across the board again. So we see those in the countries in wave two. when we compare with wave one, we see consistent results. Focus groups highlighted sensitivities around how messaging shows up in outside of donor markets. Anything that affects somebody somewhere affects everybody. So it should be concern if we don't tackle it, it will affect you somewhere else. Waiting for someone else to come help. I don't like the idea of that. Opinion leader in Ghana, the assumption that we're low income countries bothers me a lot. Leaders in South Africa, the messaging, let us help African countries so that they don't come into our country and infect us, doesn't sit right with me. And that's some watch outs for us in our messaging. And then the Global Fund messages that were tested, we can be confident that those resonate in both donor and recipient countries. Those being the progress is at risk, global health security message, the health equity message, and the economic self-sufficiency message. And again, I won't go into detail of these. We'll spend more time on conversation and you will get this deck. It's also available on the site. Overall, Global Fund messaging tested well across the markets. You see the health equity and economic self-sufficiency rising to the top. And then we did some pullouts of power words that were, I think, most effective. And you see those in the green and can spend more time with those. But thriving, healthy, investing, reducing, these are words that I think are more convincing when developing your messaging. The health equity, everyone deserves a chance to lead a healthy life. And again, so I won't spend too much time on that. And then the messengers, this is where we get into some distinctions. So wave one showed that there was little preference between donor voices and those from the global south. Wave two showed that there was more positive direction towards messengers from the global south. And we have a request from this group to test beyond just ministers. We looked at health workers, scientists as well. And wave two findings provided additional evidence of the value of global south voices, particularly from ministers and scientists. Interestingly, less distinction between the health worker category of messengers. Messenger origin has less of an impact in emerging powers. And then again, this is an interesting finding when we think about champions and championship. You've got less credible on the left, but more influential, better door openers, perhaps so religious leaders, influencers, philanthropists, etc., and then more credible on the right, health workers, scientists. So how you pair these types of champions together to gain attention, but also build credibility is an interesting finding. And then the framing, this is, I think, the other point of distinction. We did some testing and we pulled images and captions directly from the Global Fund's website, and then tested what those captions and images look like versus a more active contributor framing. So basically, on the left, the passive framing just describes what's happening. The active framing gives the person in the photo first person voice and positions them as giving advice or guidance and how the organization is following their advice and guidance. And then we looked at what impact that had on perceptions. So the active contributor framing shifted perceptions of the individual depicted from the worker to the leader to the expert. So I'll just read one and you can go into it a bit more. Ground level worker or community health worker only involved at the ground level was the perception. When we changed the caption, as a leader, he's a health expert. They're leaders. I think he must have faced the problem. He knows about this problem. And so you see the shift in perception based on simple caption changes. The active contributor also shifted how the project was viewed. Only time will tell if this project succeeds, but it's still better than nothing. Two, this gives me more trust in the health project will succeed. You have someone who's living with this in this project. So again, a pretty significant shift. And then the framing shifted the perception of the organization to one that listens and more deeply invested. The organization doesn't just do paperwork, see them working on the ground Two, it gives a positive image of the organization, that she has a voice, she can express her opinion, and they listen to her. The survey tests were a little less conclusive than the focus groups. I question this finding, but it is what it is. And then health segmentation across countries, distinct groups. And I'm not going to go into a great detail, but I think this is something that folks should spend time with separately. We looked at archetypes: concerned idealists, pessimistic sympathizers, global health skeptics, detached optimists, and complacent bystanders. There are definitions beneath those. We looked at their perceptions: a more global outlook, optimistic on progress, less global outlook, and then track them per market. And then what that might mean as to who they are, more demographic information, and then what they believe and what they think, and then how to better engage them. So this can tell us who we should spend time trying to move and who we probably should just leave alone. And again, this gets into how those subgroups responded to the messaging. So it gives us a bit more context and direction. And I'm going to stop there. I'm going to stop and note one thing that we've been thinking through at the foundation, and the arguments that I think I have been seeing in the world are the mutual benefit argument. So these investments work for both donors and recipient countries, whether it's health security, an economic benefit, soft power. Argument number one. The second is our investments have actually been paving the path to less reliance on aid over time. And so health system strengthening, programs transitioning into country ownership, greater country financing in select countries. And then the third is we're clear-eyed about what's going to stretch the dollar. So the innovations that are going to be the most cost-effective, the reforms, new financing, what are those things that are going to let donors know that this isn't something that's meant in perpetuity? And the interesting thing, I think, is that both donors and lower income countries both feel like the future should be less reliant on aid for very different reasons. Some simply might be rhetorical at this point, but I think it's something to capture in our work, that there is a shared goal and objective. And I think we have a interesting case in making that when we get to that kind of the things that we're doing are actually helping us get there. So I will stop and happy to take questions. And Katie, I hope I raced through it in the right amount of time.
Well, race is definitely the word that I would describe, but it is very helpful. And again, we will share all of these slides with you all so that you have access to them to reflect on them. But yes, it remains impressive to me the amount of time that you can spend on like a 75 plus slide deck and hopefully capture the most important points. While you were chatting, Marshall, I was realizing that for me, the way that we can interact with each other during these calls in terms of the chat function has changed. And so if other people were hoping to try and put some comments in, if you open the chat sort of function, you now have to press the blue sort of icon at the top left of that chat function, and you can select a main chat or an individual chat. So we just saw a lot of quiet in the chat, which is not always usual for our calls. And so I thought if anybody else was confused by that, because that certainly was not there yesterday for me, it may be me who's slow to uptake on technology. I mean, I try to be an innovator and stuff, Marshall, in my work, but usually I'm the last person dragged into some new app or some new tech platform. So I just thought I would mention that for everyone. And we will open it up for Q&A for colleagues who are online. I know it's a lot of information that is shared. And Peter, your test just worked through to the main chat. So there you have that. So opening it up for questions and answers. If you can find the chat, the ability to raise your hand, please do that. I see Tabby has already done it. Or if you can work the chat function, if it has also changed for you, feel free to note there or in another space. So given Tabby has her hand raised, I'll pass it over to Tabby first and then see if there are other colleagues who have questions that they'd like to raise. Go ahead, Tabby.
Thank you. Hi everyone, it's Tabby from Stop AIDS. That was really fascinating. I could spend so long looking through that presentation in more depth. I just had a quick question on the International Health Organization support. So you said there was more support for funding international health organizations as opposed to aid or something along those lines. And wondered if you could speak more to what you mean by IHOs. So was there any differences in how kind of UN health-based institutions were considered as opposed to other multilateral donor or public-private partnerships? So I just wondered if you could speak to that a bit more if you have data on it. Thank you.
Sure. We didn't test at the level of categories of organizations. The testing was between kind of overarching concept of ODA and foreign aid, which seemed opaque to people and unclear. When you got down to the level of organizations that are providing direct support, either like the Global Fund or like partners on the ground, it became much more tangible for people. And so I think the takeaway there is the more tangible that we can make the work, the easier it is for people to understand, versus kind of a broader construct of ODA, which for many seems opaque. Just as a quick recap, the big takeaways for me are, what can we do differently with emerging powers? How can they be exemplars, talking about the progress they've made, how they've made their progress, how they're both potentially a donor and a recipient, but also what's helped them kind of move to less dependence. And so I think it's a powerful example that I think perhaps we hadn't thought through. And then that second piece around the messengers and the framing.
Thanks, Marshall. Thanks, Tabby, for that question. Are there any other colleagues who have a question at this stage that they'd like to raise? I'm just going to pop into the chat a specific link for that's available on the website, if that works. I'm never sure if those Chrome extension ones work or not. But just to say, the website for the Perceptions Hub does have some sort of general ideas in terms of fact sheets and messaging. And I do find some of the examples in the joint GHI messaging one interesting to consider in terms of how we use them. Of course, with the messaging, this also has to be, this is what, I mean, Marshall, correct me if I'm wrong, but this messaging and message testing is helping us to find arguments that are persuasive, but that, we have to do more work to find ways for the arguments that we know have value and that are based in sort of the facts and evidence of the sort of issue or the institution or whatever it might be, to make those, relevant to decision makers. It's not sort of all about the messaging. We have to find a way to link how people who are receiving messages find our arguments persuasive about whatever it is that we're intending to advocate or discuss around. So
absolutely, and it might be a combination of messages that work in a single geography, and so understanding the decision maker, what drives her or him, and then being able to develop your messaging in a way that's compelling based on the research. And I know we've got a couple of investments that GFAN is working on to leverage some of the research. Those case studies will be pulled back into the Perceptions Hub at some point, so people can see the work that was done and the what they found.
Yeah, and I'm happy to talk about that after, but I hadn't seen Asia's hand raised, so I wanted to pass it to her. Yeah.
Thanks. Just quickly, did I understand you correctly that your latest wave of analysis was before the US actions, and that the subsequent effort was simply a desk review? And if that's the case, do you plan another wave of actual testing? Because it seems like that's incredibly important, and moreover, the conclusions, although perhaps a desk review kind of quasi-validated them, could benefit from an accuracy test or an update.
Yeah.
Because this is really a black swan event, and that's both harmful, but it's also disruptive potentially in a positive way, not just in communicating urgency, but in in creating spaces for doing what Katie describes, which is defining a message that's consistent with our values and principles and driving duty bearers to cohere with that message rather than being led by conservative or inaccurate ideas. So that's one question. How do we use this space? I never like to use the word opportunity when it's associated with a destructive effort, because there is no opportunity here, but we have the chance to build and repair. And then the second is around that. Did you explicitly test concepts of solidarity, not as an indirect effect, but as a reason for carrying out aid, and as a reality, like the way that emerging powers already act in regional blocks or with other countries they have historical connection with, for example, Lusophone countries across regions? Did you test those kinds of words and ideas? Thanks.
Sure. So your question is the question I asked when we got the findings back from Brunswick, and then everything happened with the U.S. retraction. You're correct in that we did not go deep into retesting. It was desk research. The Brunswick spent significant time looking at the validity of the messages and felt strongly that they were still valid. It's imperfect, but I think it's helpful nonetheless. We were not able to retest again. This project is in the 6 figures, and so we could not go back and do all of the work again. We do plan to continue this project. I'm working on a new concept now for it. It's been incredibly valuable. There have been 1,000 downloads from the Perceptions Hub, and we've done very little promotion. And so clearly there's an appetite for it. The next round hopefully will involve a greater AI function, which will allow greater customization for the person using the site. We did test solidarity in some of the messages. You'll see it in the deck and on the site. It didn't test as strongly as we had thought or we had hoped. Again, that might have changed. So again, I think Brunswick stands by the results, and we will see how effective they can be given the Black Swan event that you mentioned is the context for today.
So I think, so thank you. I think that's helpful clarification in terms of the timeline of sort of the desk research versus, the research that was done in the field, as you say, as well as what sort of the future plans are. And I think Marshall will look forward to understanding and hearing more from you about some of that. I did just want to pick up, but if there are any other questions, please raise your hand. I'm sorry I didn't see Ages before I started blabbing the last time. So please do use the raise hand function or note in the chat if you have something. But just for those sort of wondering, Marshall sort of talked about some funding that we've received specifically to work on and with this Perception Hub findings. And so these findings, despite them, they are relatively new in terms of us sort of being able to make use of them, but something that we have been working on and that you'll see come out from us before the Financing for Development conference, which is late this month, early next month, is sort of an advocate's toolkit around sort of how to, in the Global Fund context, in our advocacy context, and the knowledge that we have about the issues and the positions we typically take. You are going to see some messaging toolkit to help sort of push back on some of the general kind of negative responses that we get from governments and other decision makers, and we're very much leveraging sort of the Perception Hub data to help us to figure out some of those. And we're also engaging with a group of trainers to provide some training to some of our key colleagues, like our Global Fund, our GFAN speakers, and a number of other colleagues to help with fine-tuning that messaging and trying to make use of some of these findings out of the Perception Hub. For us in particular, we found, overall, a lot of the findings have kind of reinforced some of the work or some of the ways that we have tried to message GFAN's work for many years already, in terms of making sure that the voices of communities and civil society are the experts in the conversation, and that they are not just at a decision-making table, but at the conversations that happen before the decision-making table. So not just consulted, but active participants in designing and thinking about sort of interventions and what works in their communities. And so we're really keen to try and see if there's ways that we can fine-tune our messaging around that, given these sort of findings. Because again, it is something that we've, tried to highlight and tried to work with for many years already, as well as the microeconomic sufficiency arguments that are in the Perceptions Hub data that talk about how powerful it can be for potential donors, decision makers, et cetera, to hear directly from the people with the experience in the field of implementing programs, et cetera, about sort of that micro economic benefits of these kinds of investments, as opposed to those larger macroeconomic ROI investments that typically, we talk about them, but sometimes they aren't enough to sort of push the needle. So you'll start to see a bit more from us on that you might recognize some of the language because we will be lifting off of some of the findings here in the Perception Hub work. So if there are no other questions, thank you for the clarification, Marshall, in the chat. If there are no other questions, then I think we can say thank you to Marshall for joining us at I think it's a ridiculously early hour where you are, 5:30 in the morning or something. Yeah, sorry about that.
I'm an early riser.
Well, thank goodness for that. That helps us. So thank you very much, Marshall, for joining us
Sure.
and for sharing the slides and for sharing your perspectives. I think it's appreciated. And again, another year of me congratulating you and mentioning how fast you go through massive slide decks. So there you go. But thank you so much, Marshall.
Thanks, everybody.
Okay.
Bye-bye.
Bye. And so we will move on to our next agenda item in terms of our call today. And we wanted to invite some of our Canadian colleagues to share with us some of their reflections ahead of the G7, which honestly, I keep saying it's next week. And I don't know that it's next week, but it's really, really soon. But I keep losing track of the dates on my calendar. So it's very soon. It might be the week after, but it's very soon. I think 13th, something like that of June. So I think we were going to pass it over to colleagues from Results Canada to share a quick overview. I believe there is one slide that might come up, or there may be more, but I'm going to pass it over to Lee. Sorry, now I've lost my participants here. That's very helpful. I'm going to pass it on to you, Lee, from Results Canada, and then there are some other Canadian colleagues, the two Robins, as I've started to call them, I think, who are going to jump in with some additional details. But Lee, over to you, please.
Great. Yeah, I think Robin Montgomery has a slide kind of on more of the intel from the G7, but I'm going to quickly talk about, from Results Canada side, some of the work that we've been doing. Results Canada has been working with partners to elevate the issues that we focus on at the G7, obviously including the Global Fund, but also a really big push to get Canada to champion an education, peace, and security initiative. But in terms of the Global Fund, it's unlikely to be a space for governments to make a formal pledge, but we are collaborating with partners to encourage leaders to use this platform to demonstrate their support for the Global Fund. So one thing that we're doing is we're working with our partners in the UK to explore opportunities to get Prime Minister Starmer as co-host of the replenishment to engage with some of the other G7 leaders on the Global Fund while they're at the summit. And then from more of the public engagement, volunteer engagement side, Results Canada just launched our Global Fund replenishment campaign. So with our June call to action, we focused on how the Global Fund is a G7 legacy and kind of tying to the history of the Global Fund and using this month's G7 in Canada as a moment to spotlight that work. So I can share the call to action in the chat for anyone who's interested. And we are using the hashtag #WinTheFight throughout the campaign. So if anyone wants to use that, it's kind of a play on the Fight for What Counts at the 7th replenishment, and then also the replenishment launch video that the Global Fund came out with called A Fight That We Can Win. So feel free to use that, and we'll be using that over the course of several months. And we just hosted a volunteer retreat this past weekend to kind of kick off our Global Fund campaign, where 60 volunteers from across Canada came together in Ottawa learn about advocacy and take action on the Global Fund. So they called their MPs, they posted on social media, wrote letters to the editor, and those are kind of the actions that they'll continue to take, and more strategic actions over the course of several months. So feel free to check out the campaigns page. We'll update that every month with more strategic actions that you can all take as well. And then early next week, Results Canada is going to be releasing a video that actually was created at the GFAN meeting when a lot of you were in Ottawa. So we took some videos with some of our G7 partners, all calling on our respective leaders to step up at the G7 summit. And that will be released early next week. And I'm happy to share that across relevant listservs with a pre-drafted message just for ease of sharing. So I'll follow up with that. And then we'll just keep a close eye on the outcome of the G7 and respond on especially how Canada showed up. So that would be another asset that you can look out for just in the days following the G7. That would be really helpful to amplify. But that's it from me. And I think Robin Montgomery will give a bit more information about the G7 itself.
Great, thanks, Lee. Really exciting stuff, and I really appreciate also looking at the response to the G7 communique or the discussions that happen there. So really excited to support that. Okay, can everybody see the slide?
Yeah.
Perfect. So just wanted to give a very quick update on where we are at. And Robin, if you want to jump in at any point, please do, okay? But just so by way of an update, we know that this has been a really very difficult process to actually get any information about. And to date, there still isn't.
Robin, so sorry. We
Sorry.
can't see your slide because there's like a drop-down box over it at the moment. Just letting you know.
Really?
Yeah.
Okay, let's see. Oh, I do see that for some reason. Okay, so I think it's because I was in full screen. So let's try this again. I'm not really a friend of Google Slides, but let's see.
It's up again and we can see it. So
Okay, so is it big enough?
I think if you can start the slideshow so that it shows it, it's probably better for others. But see, that's where it keeps getting stuck. Robin, why don't you go ahead and keep talking in? I've got the link to this and I'll get it up on the screen for you.
Great, thank you. That's terrific. All right, so it's been a very opaque process, and that's because of a number of different factors, including the Black Swan event that Asia was talking about. But we've been without a government for quite a while. And so in that whole election process, the government has been in, the Liberal government, the Trudeau government, has been in caretaker mode, which means it is there to respond to crises, but is not able to really move forward on any specific policy issues. So that included around the G7. So the government now, the Carney Liberal government, is very busy getting everything set up. What we have been working on as civil society here in Canada is to ensure across the different official engagement groups that are part of the G7, so like the Civil 7, Women 7, Pride 7, that there is strong recommitment to a fully funded 8th replenishment for the Global Fund in all of our publicized communiques that also go to the G7 Sherpa and so on. So we've been very lucky to get strong recommitment. It is well placed within the Civil 7 communique and the Pride 7 communique. There are murmurs and rumors of a possible international development G7 ministerial sometime in the fall. So we're keeping our eyes open for that one. As I mentioned, no G7 agenda yet, But the C7, which is the Civil 7, has secured 15 spots for civil society to join the G7 Media Center. So if you are interested in doing that, it is going to be obviously in Alberta for June 15th to the 17th. Please let me know and I can forward you on to the C7 Sherpa to be able to apply for that. Just last week or the week before, at the end of May, there was a G7 finance ministerial with the heads of banks, of national banks. And the communique came out. The Civil 7 has responded to that communique, and I've put the link here in the slide. And the focus, it's a fairly it's a strong response, really looking at how G7 leaders can use the opportunity to strengthen their action and commitment around debt reform and cancellation, around the need for G7 leaders to really subscribe to and commit to an international framework for tax collaboration, fair and sustainable trade, and then there was a significant section on overseas development assistance, ODA, and to return to its intended purpose and levels. So that was a very strong piece as well. In terms of next steps, we've come to a civil society Canadian ask to the Canadian government for the 8th replenishment, and it's built on being ambitious and building on Canada's global health legacy. So that will be part of our communications moving forward. Tomorrow we have an informal global health working group meeting. So I've put the times here and I'll put the link to the Zoom meeting in the chat, and I welcome anyone who would like to join. What we're going to be talking about there is developing an open letter to the G7 leaders, and we will pass that around for sign-ons here in Canada, but also really hoping for your support in that as well. There are plans in the works for a protest event on Parliament Hill, and I'll let Robin speak to that in a minute. And then finally, together with the HIV Legal Network, the Public Health Alliance of Ukraine, Input, and GFAN, we are holding an event in September in Ottawa that's going to target the G7 Sherpa, ministers, members of parliament, and all of our community and civil society partners, where we are going to be placing first and foremost the experiences and the stories, the innovation and the resilience that we have seen in Ukraine and Côte d'Ivoire, put them really at the forefront, showcasing what the Global Fund's impact is and how that has an immediate individual impact. We are developing an advocacy paper that we will start to communicate within Global Affairs Canada and with the different ministers well in advance of this meeting in September. So that is it in a nutshell, but I'm going to hand it over now to Robin Waite to talk a little bit about the Parliament Hill event.
Thanks, Robin. Hi, everyone. My name's Robin. I'm based in Ottawa, Canada. So yeah, just yesterday we had a group discussion with other organizations and people in Canada around a potential stunt on Parliament Hill during the G7, and there seems to be enough appetite and interest to move forward with that. And we have a plan now, so that's great. So essentially, the message is very simple. The message is cutting ODA costs lives and is killing people. So we want to see G7 countries who have cut aid restore that funding, and wanting to put a little bit of a special focus on Canada because we are in Canada and we will be on Parliament Hill, calling on Canada specifically to continue to champion ODA because we have not cut ODA and we have a budget anticipated to be tabled in the fall, and to provide whatever lifeline that we possibly can as a country to the life-saving projects that have been impacted by these cruel cuts. In terms of the visual that we're going with now, we've come to like a die-in sort of a thing. So we will have people die on the lawn of Parliament Hill I mean, a die-in is a very common form and tried and tested form of protest. And then we will have people with a Canada flag on their back run in and start to perform CPR. Very open to feedback and reactions to these ideas. This is just what we workshopped as a group together yesterday to put attention on G7s who have cut funding, and also provide an opportunity for Canada to see itself as a champion and a leader, particularly where Carney says if the US won't lead, Canada will. So holding him to those words. And we secured funding from bigger than our borders to hire a videographer and photographer to come to this moment and capture content. And the idea is that the videographer would go up to each person performing CPR and get the story of the person who is dying. And we can use real stories from around the world about the impact of cuts to ODA. So keen to hear your thoughts and reactions. There's not a ton of time to pull this off, but we're going to hustle hard to make it happen. We'll have a press release, we'll have content to share after. And if you have real stories from around the world that you think would be appropriate, or you would like to see spotlit in those kind of interviews with the person trying to save a life, please send them my way and we'll give them that script.
Thank you, Robin, and Lee. That's helpful. There was a question to understand what the acronym CPR means in the chat, which does mean that you go back and help somebody who's in distress to breathe again. So that I don't know actually what it stands for. I think here in Canada, we just have learned CPR. So there you have it. Are there any questions for our colleagues here in Canada in terms of the G7 and C7 work? Or are there colleagues who wanted to share some of the efforts that they're making in their countries around reaching out to, or reaching out to G7 leaders, or making asks against G7 leaders over the next few weeks, given the heads of government? Any questions or comments from colleagues? Sorry. I was trying to do too much on my screen at once. Okay, I'm not seeing any hands raised, so I think we'll say thank you to our Canadian colleagues. I think Marshall had to get off the call and probably do another one, but thank you to our colleagues from the Gates Foundation who did come on to share the information about the Perception Hub. Hopefully at the moment, I'm sharing a screen that just wraps up some of the discussions and shares some of the information that we covered, including what Lee said, the hashtag win the fight, which is what they'll be using here in Canada, and maybe something that you can at the very least try to follow along with over on your social media platforms over the next few weeks as the G7 is taking place in Canada. Peter, is that a hand raised? I can pass it to you real quickly.
Yes, very, very quick. I just wanted to congratulate Robin, both Robins actually, and Robin too, for doing the die-in. When we did our die-in in front of the Chancery a couple of years ago, colleagues said, this is so old-fashioned, this is still necessary. And yes, it is still necessary. So this is a message in itself. So thanks so much for doing that, Peter.
Thanks, Peter. I was also remembering the GFAN meeting when we did that in front of the Chancellor's office. So again, from us at GFAN, you will see some work coming out later this month ahead of the Financing for Development conferences taking place around that sort of responding to common negative perspectives, but also, using some of the positive ways in which messages around the work that we do seem to be being well received. So that will be coming out from us. And just to say thank you to everybody for joining us today. We'll have our regular call again in 2 weeks. We have an interesting conversation about digital health with our Developed Country NGO delegation colleagues to the Developed Country NGO delegation to the Global Fund Board colleagues joining us for that, as well as a number of experts. And we'll share more information about that over the Lister shortly. But again, we'll place the recording from today as well as the links to the slide to the slides, slide decks, and other sort of links that were shared today on our website in the coming days. So thanks very much for joining today. I hope that you found it useful, and I hope everybody has a good rest of their day wherever you are. Thanks, everyone.
Thanks, GFAN.
Thanks,
Thank you.
Ben. Chat soon.
Dankeschön.